Imagine you're at your annual checkup, trusting your doctor to keep you healthy and vibrant in your golden years. You're told you need a routine test, a quick scan or procedure to stay safe. But what if those tests, the ones pushed as essential, are silently steering you toward unnecessary surgeries, complications, or even cancer? For seniors over 70, this is a hidden truth buried in the science. Up to 37% of medical tests lead to treatments that do more harm than good, with risks like stroke, kidney damage, or lifelong side effects. Shockingly, 99% of people over 70 don't know they're being overtested. One test, our number one, is so risky it's linked to 5% of all U.S. cancer cases, matching the impact of daily alcohol consumption. You won't hear this from your clinic or see it on a billboard, but today, we're uncovering the truth. We're sharing 5 health checkups to avoid after 70, backed by science, to protect your health and quality of life. Let's transform fear-driven testing into empowered, life-affirming choices. Before we start, drop a comment with where you're watching from, your age, and if you've ever regretted a test or felt seniors are overtested. We're reading every comment and offering personalized tips. Now, let's dive into the first test, seemingly harmless but potentially life-altering. 5. Bone Density Scan, DEXA scan. The fear-inducing trap. A bone density scan, or DEXA scan, sounds like a no-brainer. A quick, painless test to check if your bones are at risk for fractures. But for seniors over 70, it often sparks more fear than benefit. This scan measures bone strength to detect osteoporosis, but in older adults, especially women, it almost always shows lower density because bone loss is a natural part of aging, like wrinkles or gray hair. The problem? These results push many into medications like bisphosphonates, e.g., alendronate, which promise stronger bones but carry serious risks. Jaw necrosis, where the jawbone dies, esophageal irritation, and brittle bones that break abnormally. A 2017 Journal of the American Geriatric Society study followed 1,200 women over 70 and found bisphosphonates reduced fracture risk by just 0.3% after 5 years. Barely impactful, while side effects like digestive issues and inflammation were far more common. Take Rose, a 76-year-old retired piano teacher who loved her daily walks. Her routine DEXA scan showed osteopenia, a mild bone density reduction, not osteoporosis. Her doctor prescribed alendronate, and within 3 months, she suffered severe reflux and jaw pain, sidelining her from playing piano. We stopped the medication and started her on vitamin D, weight-bearing exercises like resistance bands, and a calcium-rich diet with sardines and leafy greens. A year later, Rose was back performing recitals, with stronger legs, better balance, and no fractures. For seniors without falls or fractures, lifestyle changes, strength training, balance exercises, and proper nutrition reduce fracture risk by over 20%, per a 2022 Osteoporosis International study. Don't let a scan's numbers scare you into treatment you may not need. 4. Brain MRI for memory loss. The panic trigger. Forgetting keys or names can spark fear of dementia or Alzheimer's, prompting doctors to order a brain MRI. But for seniors over 70, this detailed scan often shows normal age-related changes, like slight brain shrinkage or white matter spots, that trigger unnecessary worry and invasive procedures. A 2021 Neurology Today study reviewed 3,000 MRIs in 70-85-year-olds with mild cognitive complaints. 86% showed abnormalities, but only 3% were treatable conditions. Alarmingly, 12% led to invasive follow-ups like spinal taps or biopsies, causing emotional distress and physical complications with no memory improvement. Consider George, a 74-year-old retired engineer who worried about occasional forgetfulness. His MRI showed white matter changes, leading him to fear dementia. He stopped driving and attending church, and his anxiety worsened. A simple cognitive screening test revealed his memory was normal for his age. With lifestyle tweaks, better sleep, hydration, and brain games, his memory stabilized within 3 months and he regained his confidence. Unless you have severe symptoms like seizures, sudden personality changes, or rapid functional decline, MRIs for mild memory loss are rarely helpful. A paper-based cognitive screening test, assessing memory and problem-solving, is a safer, cheaper first step that avoids panic and risky procedures. 3. Cardiac stress test. The false alarm factory. If you've mentioned mild fatigue or chest tightness, your doctor may suggest a cardiac stress test, which monitors your heart during exercise or medication to spot blocked arteries. After 70, this test often does more harm than good, especially without clear heart disease symptoms. Studies show a 40% false positive rate in seniors, leading to unnecessary angiograms, stents, or bypass surgeries with risks like bleeding, kidney injury from contrast dyes, and prolonged hospital stays. A 2017 JAMA cardiology study found over half of stents placed after stress tests were in patients with no symptoms or benefit, offering no improvement in survival or quality of life. Raymond, a 75-year-old retired postman, walked daily but felt tired on hills. His stress test results were unclear, leading to a catheterization that found mild artery narrowing. A stent was placed, but the contrast dye triggered kidney problems, landing him in the hospital for 6 days. His fatigue? Not a heart issue, just a need for better hydration and rest. Unless you have classic cardiac symptoms, chest pain during activity, shortness of breath on exertion, or significant energy drops, a stress test is risky. Safer options include a resting EKG to check heart rhythm or a low-radiation coronary calcium scan to assess plaque buildup. 2. Colonoscopy. The risky routine colonoscopies, using a camera to examine the colon, are often routine for cancer screening, but after 70, and especially after 75, they're rarely wise without specific symptoms. The harsh laxative prep can cause dehydration, dizziness, or kidney issues, while sedation risks brain function and heart rhythm disturbances. A 2019 JAMA internal medicine study of 1.3 million Medicare patients over 70 found that for every 1,000 colonoscopies in those over 75, only 2 lives were saved, but 20 faced serious complications like bleeding or bowel perforation. A 10-to-1 risk-to-benefit ratio. Many polyps found are slow-growing and harmless in seniors, making removal riskier than leaving them. Dana, a 73-year-old grandmother running a bakery, had no symptoms or family history of colon cancer but got a routine colonoscopy. A small polyp removal led to a bowel perforation, a 9-day hospital stay, 10 pounds of weight loss, and lasting health impacts. She'd had 2 clean colonoscopies before, there was no need for another. The U.S. Preventive Services Task Force recommends stopping routine colon cancer screening at 75. For those in good health, a non-invasive FIT test, a home fecal test, is safer, requiring no prep or sedation while catching most concerning cases. 1. Annual full-body CT scans. The cancer-causing culprit marketed as a way to catch cancer early, full-body CT scans are a dangerous trend for seniors over 70. Often offered in executive health packages. Each scan delivers 10-20 millisieverts of radiation, equal to 500 chest X-rays. A 2023 JAMA internal medicine study links the rise in CT scans to 5% of U.S. cancers, matching alcohol's impact. These scans detect harmless nodules or cysts common in aging, triggering a cascade of follow-up scans, biopsies, and surgeries with no proven survival benefit. The American College of Radiology warns against their use for general screening in asymptomatic adults. Marcus, an 80-year-old martial arts teacher, felt great but got a full-body CT during a senior elite checkup. A 3 mm lung nodule led to a PET scan and biopsy, which collapsed his lung, requiring hospitalization and a 2-month recovery, all for a benign finding. If you're symptom-free, Avoid full-body CTs. Targeted imaging is only justified for specific symptoms like unexplained weight loss or coughing blood. Regular checkups with your primary doctor, listening to your body, are the smarter path. Empowering your health choices. Modern medicine is powerful, but it's not perfect. Sometimes less is more. To make health checkups a blessing, not a burden. Ask, what happens next? Understand what abnormal results mean and weigh risks against rewards. Prioritize lifestyle. Stay active, eat nutrient-rich foods, sleep deeply, and address vitamin D deficiencies for true prevention. Choose safer tests. Opt for non-invasive options like cognitive screenings, fit tests, or resting EKGs when possible. Listen to your body. Only pursue tests for clear symptoms. Avoid fear-driven screenings. Your path to vibrant health. Bone density scans, brain MRIs, cardiac stress tests, colonoscopies, and full-body CT scans may seem like safeguards, but after 70, they often bring more harm than help. Rose, George, Raymond, Dana, and Marcus faced complications from tests they didn't need, but their stories show the power of informed choices. By focusing on lifestyle, exercise, nutrition, and sleep, and questioning unnecessary tests, you can protect your health and thrive into your 80s and beyond. Your body deserves care that uplifts, not undermines, your vitality. Thank you for joining us on this journey to wiser health decisions. Share your experiences with overtesting in the comments. Have you or a loved one faced complications from an unnecessary test? We're here to listen and offer tips. Hit the like button, subscribe, and tap the bell for more senior health insights. If you're concerned about your health, check our video on spotting critical symptoms, link in the description. Stay empowered, stay healthy, and let's make your golden years truly golden.